should be all set.
Yes.
Well, hello, everyone. Thank you very much for joining us this afternoon. For those who I don't know, I'm Kevin Kiley. I represent the 6th Assembly District, which includes a lot of the communities around here in Placer, Sacramento, and El Dorado counties. And, obviously, this has been a very tough year in a lot of ways. So when I heard about this workshop and the opportunity to provide it to folks in our area, anything to sort of make life just a little bit easier, I wanted to provide that opportunity in this forum. And I want to thank our partners with Chapter who are going to be actually providing the substantive information today. The goal here is to provide you with helpful information regarding important deadlines, how to enroll in Medicare, and also how to avoid common mistakes. Now, no one needs to tell you that Medicare is complicated. The original Medicare Act from 1965 is 1,300 pages long, and believe it or not, it has not gotten simpler as time has gone on, quite the contrary. While it's a federally created policy, it has local implications for all of the seniors in our community. Different Medicare options have different hospitals, doctors, and pharmacies included in their networks, as well as different costs for each. The original Medicare, known as Part A and Part B, covers only 80% of medical expenses and doesn't cover prescription drugs, dental, vision, or hearing care. These are significant gaps because they can leave you responsible for the uncovered costs, of course. And the government has allowed private insurance companies to create several other types of coverage that you can use to fill those gaps. Now, looking just at my district, which includes about 500,000 people in this area, there are at least 3 different types of plans to fill gaps in Medicare coverage. There are also more than 70 different specific plans offered by more than 20 different insurance companies. So to lead today's workshop and to provide some level of simplification to help navigate all of this is Ari Parker with Chapter, which is a Medicare organization whose mission is to help seniors navigate the Medicare process. Ari is a Medicare expert, a Stanford law educated attorney, and he is, I am told, read all 1,300 pages of the Medicare Act. I guess, Ari, maybe you keep that on the nightstand as nighttime reading. But he'll be providing an overview on Medicare and the different choices that are available to you. I also want to add that his presentation will be 20 or 30 minutes, and after that, there will be a question and answer period. But you can submit your question at any time. Just go ahead and enter it in the comment field on the YouTube Live, and then we'll get to that once he's finished his presentation. And Ari has also generously agreed to speak one-on-one with anyone who has additional questions, and he'll share his contact information at the end of the presentation. Ari, welcome.
Thank you, Assemblyman Kiley. That was a great introduction. I'm blushing. The Medicare Act actually is on my nightstand, in fact. And it's a pleasure to join you and your constituents to talk about Medicare. As Assemblyman Kiley mentioned, my name is Ari Parker. I've dedicated my career to helping people make better choices around Medicare. And I know you may be wondering if I just got my driver's license, but I'm actually in my mid-30s, and I'm the lead advisor at Chapter. We help thousands of seniors just like you every single year learn more about Medicare, and it's free of charge. Ultimately, I want to make sure that you're empowered with the knowledge you need to sign up for Medicare. And the complexity of the process is the reason that many people reach out to advisors like Chapter. I know that's why Assemblyman Kiley invited me to speak today, and it's really a credit to him and his whole staff that they got interested in what Medicare and the Medicare enrollment process means to you. I also want to stress that my presentation isn't just for seniors who are becoming eligible for the first time. The steps that I'm going to discuss apply to every single one of you, except my wife, Molly, because we have found that your plans, costs, and benefits can change every year. That's why it's key to get an annual Medicare checkup, and I'll return to that throughout our time together this afternoon. Finally, I know you'll definitely have questions along the way. Please drop them in the comments below. There'll be time for me to address them at the end. I also want you to have my email address in case you'd prefer to address your situation one-on-one. As Assemblyman Kiley mentioned, that way we can go into a lot more detail together and get into some personal factors that may apply to you. So feel free to reach out by email, or my phone number is listed. All right. Our agenda for this afternoon is that I'm going to introduce a fusion of two types of clients from your community that we've helped, Ronald and Linda. Then I'm going to walk you through the three critical decision phases that you'll need to go through as you choose Medicare coverage. And these three stages are something that we walked Ronald and Linda through already. And finally, I'm going to address the 5 most common mistakes we've seen people make. I want to share those mistakes with you so that you can avoid them in the future and not make them. Meet Ronald and Linda. They're composites of members of your community. I especially like Ronald's beard. I took after him today. Ronald just turned 65 last week. He's retired. Linda's a bit older and hasn't retired yet. Linda also has health coverage through her employer, whereas Ronald is ready to start using his Medicare benefits, as you'll see. Budget-wise, Ronald is mostly reliant on Social Security. He needs that to pay for retirement, whereas Linda has saved quite a bit. And finally, you'll note that Ronald mainly enjoys staying in and around Granite Bay, whereas Linda loves to travel. Post-COVID, she wants to use her savings to do it as much as she can. Now I want to show you the journey that my team took Ronald and Linda on. There were 3 decisions that we helped advise them on. First, we helped them sign up for traditional Medicare. Second, we advised them to consider additional coverage. The reason is because Medicare doesn't cover all of the costs or all of the care that you need. Assemblyman Kiley already did a great job explaining why that is. There are simply gaps in your coverage that Medicare doesn't account for. Third, once you've decided on additional coverage, you need to look at specific plan options. And so for Ronald and Linda, we helped enroll them so that there would be no gap in coverage once they started their retirement. But don't worry, I'm going to walk you through each of these stages so that you understand them and feel confident about Medicare and can ask the right questions when it's time for you to enroll. So step 1, signing up for traditional Medicare. There are 2 parts to traditional Medicare. Part A is hospital insurance. It covers inpatient care, care in a skilled nursing facility, and home health care. Part B is medical insurance. It covers things like visits to the doctor's office and preventative services like flu shots, certain disease screenings, even your annual checkup. How do you pay for Part A? Well, for most people, your Part A premium is already paid for. It's been deducted as a payroll tax during your working years. Part B is where it gets interesting, though. In Part B, many people don't know that you actually have to pay your premiums to the government to get your Part B coverage. It's not covered 100% by your taxes. If you're enrolled in Social Security, your Part B premium is actually going to be deducted from your Social Security check. And if you haven't signed up for Social Security yet, you're actually going to get a bill from Medicare for your Part B premium. Now, you might be wondering, how does this apply to Ronald and Linda? When should they enroll in Part A? Well, it's straightforward for both of them. We advise clients like Ronald and Linda to sign up for Part A as soon as they're eligible. The reason we do this is because they've already prepaid their premiums during their working years. There's no reason for them to wait to start drawing their Part A benefits. It's something that they're owed. What about Ronald and Linda's Part B decision? Well, Ronald's case was pretty straightforward. He retired at age 63, so he was ready to start using Medicare as soon as he approached 65. We advise seniors like Ronald to sign up for Medicare as soon as they're eligible in order to start receiving those Part B benefits. Yes, you're going to have to start paying the premiums, but the benefits clearly outweigh here because there's so much that you get in return. For Linda, it was different though. We actually advised Linda to wait to enroll for Part B until she retired. Why? Why did we advise Linda to wait? The reason is because she would have had to start paying her Part B premium and she was already getting her health coverage through her employer. Instead, Linda's going to get something called a special enrollment period, and I'll cover that in a minute. So I've addressed Part A and Part B, and whether you should sign up for them if you're working or retired, but I want to go into detail on when specifically you can sign up for Medicare. These are the deadlines. For those like Ronald who sign up, who retire around age 65, you can actually sign up 3 months before your 65th birthday. And that initial enrollment period will extend another 3 months after your 65th birthday too. What's critical to remember here is that it's a 7-month initial enrollment period. That's really important. You have 7 months as part of your initial enrollment period if you want to sign up for Medicare when you turn 65. How did this apply to Ronald? Well, his birthday was last week. So the earliest that Ronald could have signed up would have been July 1st. He actually signed up sometime in July, so that's pretty good. He got on it early. And the latest that Ronald could have signed up if he'd chosen to procrastinate, don't do that, would have been at the end of January of next year. So January 31st, 2021 is the latest that Ronald could have signed up. What about seniors who are past the age of 65 and thinking about retirement? When could someone like Linda enroll? Well, Linda and people who are already already have employer health coverage have 8 months after they leave their full-time employment to sign up for Part B. There may be other constraints you need to consider depending on the type of additional coverage you'd like to purchase. But what I want to emphasize here is that if Linda's situation applies to you, you don't want there to be a gap in coverage between the end of your job and the start of your Medicare Part B benefits. These rules are written by the federal government, and it's just, you don't want to mess with these rules because you're going to end up owing a lot in penalties if you do. And it's not an automatic process in order to enroll into Part B. So it's in order to understand what options are available to you, and handling the complexity is a big reason why it might be helpful to work with an independent advisor so that you can weed through these regulations and navigate them without owing something to Uncle Sam. In fact, the main reason that people like Linda and Ronald come to us is because, as Assemblyman Kiley mentioned, traditional Medicare doesn't cover all your medical costs. In fact, traditional Medicare leaves you with at least 20% of your medical costs. 20% can really add up if you see several doctors a year or if you choose to work with a specialist. And that's going to come up, those hard-earned dollars are going to come straight out of your pocket. They're not going to be covered as part of your Part B. But there's more. There's a whole category of costs that traditional Medicare doesn't cover at all, not even partially. In fact, traditional Medicare doesn't cover prescriptions, vision, hearing, and it also does, dental, and it also doesn't cover hearing. When people realize that there's a whole category of costs that traditional Medicare doesn't cover, it's actually the #1 thing that motivates people to reach out to us and to think about purchasing additional coverage, because they realize that there might be gaps and they don't want to be left holding a huge medical bill. So that's why I want you to be aware of these gaps as early as possible. And I don't want you to have to pay to write these big checks to your doctor that you thought Medicare was going to cover. So that's why it can be really helpful to talk to an advisor. And we see this every day because that's why 60% of Americans and growing purchase some type of additional coverage for Medicare. All right. So I've covered Part 1 of your journey, how to sign up for Part A, how to sign up for Part B, and now it's time to consider additional coverage. And again, this is really important because you don't want to be left paying for medical costs or for these supplemental benefits that you thought were going to come through traditional Medicare. So with that, let me turn to stage 2. Now, this is the most tedious slide of the presentation, but the reason I put it here is that I want to break down the differences between Medigap and Advantage plans. Medigap sits on top of traditional Medicare. That means it actually provides you with more choice because you can see any doctor who accepts Medicare. And it also covers the 20% you'd otherwise have to pay. That's why it's called Medigap. And I just want to emphasize the sits on top part. You're still using traditional Medicare if you purchase Medigap as your additional coverage. Now, what about Medicare Advantage? What do I mean by that? Well, some people refer to Medicare Advantage as Part C. The reason is because it's a substitute for traditional Medicare. Those Parts A and Parts B are instead provided through the Advantage plan if you choose that as your additional coverage. It's actually administered through private insurance companies, in fact, and many people actually prefer that, as you'll see. I know that Ronald did. And I want to say that these plans can often include the additional benefits that Medigap or traditional Medicare doesn't cover. So which type of additional coverage did Ronald choose? I actually gave away this answer already. He chose an Advantage plan. And there are a few important things you should consider when thinking about purchasing a Medicare Advantage plan. 4 things in particular. The first is it's the most inexpensive type of additional Medicare coverage, and some plans offer $0 premiums. How do they do that? That's because the government is paying for it, not you. Second, many of these plans include some type of prescription drug coverage. In fact, if you don't go the Advantage route, you'll have to pay for a standalone Part D prescription drug plan if you want your prescriptions to be covered. Third, Medicare Advantage plans typically have a network of providers, which is a predefined group of healthcare providers that allows the carriers to offer lower premiums so the plans can be priced more affordably. And fourth, there are additional benefits that these plans include, like dental, hearing, vision, and many of them even include free gym memberships as a perk. The final thing I want to stress is that, and I'll repeat myself here in a moment, you can't have an Advantage plan and a Medigap plan. It's one or the other. So now that I've addressed Ronald's additional coverage, I want to discuss what type of coverage Linda selected. Linda's priorities are different than Ronald's. She's not as worried about premiums, and instead she wants to see any doctor who accepts Medicare without a referral. She wants as expansive a network as traditional Medicare would provide. That is, any doctor who accepts Medicare, Linda wants to be able to see. So that's why we advise Linda to go with a Medigap plan, because that way she can see any doctor who accepts Medicare without referral. And she's going to have to pay a little bit more for that. So what should you know about Medigap plans? Well, 3 things. The first is if you have a Medigap plan, you can see any doctor who accepts traditional Medicare. You're not limited by a carrier's network as you might be in an Advantage plan. The second thing to know is that there are only certain points in time you can sign up for a Medigap plan. This is called a guaranteed issue window. I'll come back to it in a minute. And third, as I mentioned, Medigap is a little more expensive than an Advantage plan because you pay a premium to your Medigap insurance carrier. Just like with an Advantage plan, you still owe your Part B premium though. And I know I may sound like a broken record, but you can only buy one or the other. It's either a Medigap plan or an Advantage plan. You can't have both. So on the last page, I mentioned Linda's guaranteed issue window. What's that? Well, a guaranteed issue window is a period of time where you are exempt from medical underwriting. That means an insurance carrier has to sell you a policy. They have to cover all your pre-existing conditions, no exclusions. So this means that if you had diabetes develop in your 50s, or you may have had a battle with cancer, you can't be denied a plan for that reason. And better yet, you can't even be charged more for it. The carrier cannot charge you more when you're operating under your guarantee, when you're choosing a plan under your guaranteed issue rights. So what I stress to all Californians have at least one guaranteed issue window by law, but it's a time-specific window that covers the first 6 months after you start your Part B. And I didn't write these rules, but this is what applies to you in California. And it's really a pain to go through medical underwriting. You want to make sure to avoid it if you can. The complexity of the guaranteed issue window is a big reason clients reach out to us. The rules are just a mess here. So ultimately, the best way to make sure an insurance carrier can ask you personal medical questions or about your past medical history is to start the process now so you can make sure you know when your guaranteed issue window is, because everyone has at least one, and so that you can choose a plan under your guaranteed issue window. That's really the way to maximize your flexibility and to avoid prying questions from insurers. You may have noticed something. I haven't talked about Linda's drug coverage. That's because Medigap doesn't cover your prescriptions. What did this mean for Linda? Well, we advised her to buy a standalone Part D prescription drug plan. And here's what that means in practice. So Part D drug coverage is the way that you cover your prescriptions. It's partly paid for by the government and it's partly paid for by you. It's technically optional, but it's highly recommended. And there are two reasons here. The first is there's a lifetime penalty if you don't sign up for your Part D drug coverage, but then later choose to get Part D drug coverage. And I'll cover that at near the end of the presentation. And the second reason we advise seniors, or we advise you to use to choose a Part D drug plan, or to make sure that your plan covers Part D, is because you don't want to be in the situation where a new prescription is recommended to you, but you've missed your window, so you have to wait several months in order for that drug to be covered. You want to make sure that there are no gaps in your coverage. So how could you get it? Well, the first way would be through purchasing a standalone Part D plan, as Linda did. And the second way would be as part of a Medicare Advantage plan, like the one Ronald chose. So, as I just discussed, Linda and Ronald made different choices for their Medicare Advantage and their Medigap journeys. But before I turn to the final stage, I just want to walk you through these differences and recap them. So here's what you need to remember about Medigap plans. Medigap plans have higher premiums, but they lower your out-of-pocket costs in the forms of copays or deductibles when you get sick or you go to the hospital. Medigap allows you to see any doctor who accepts traditional Medicare, so you don't need a referral. We typically advise clients like Linda to purchase a standalone Part D drug plan. And finally, Medigap doesn't include supplemental benefits that you might otherwise get under an Advantage plan. By contrast, Medicare Advantage plans have they have lower premiums, they have higher out-of-pocket costs, and they typically have a predefined network through the carrier. They usually come with prescription coverage, and many Advantage plans offer supplemental benefits like dental, hearing, vision, and some even have other perks beyond that. So, all right, you've decided the type of additional coverage that's right for you. There's still one more step remaining. So you know the enrollment deadlines, you're in Part A and Part B, and you figured out what type of additional coverage you'd like to purchase. But now it's time to choose a specific plan. That's the final step. And that's the last stage of the journey. And it's where it really counts to work with an independent advisor who can search all plans for you. The choice between plans is a personal one, and the plan you sign up for really depends on your specific life circumstances. Just look at your own community. This table shows, and Assemblyman Kiley actually mentioned it at the beginning, this table shows just how many plans there are in your own community. There are over 70 Medigap options and more than 35 Advantage plans for you to choose from. That's a lot of different options within each type. And what's different across these plans? Well, for one, each plan is priced differently. If price is the most important factor to you, then that's really going to be something to consider. And then second, there are also other differences. And these factors are based on the benefits of the plan, the deductibles and the copays. For example, whether you're willing to pay a little more premium upfront in order to have more protection on the back end in case you have really big bills, or whether you want to take that risk and pay a low deductible upfront, but cover a little more of the risk in case you really need to use your plan a lot. And then these plans are also different on the out-of-pocket maximums, as I just alluded to. And finally, which doctors are covered, which physician networks. And so again, we find that this is a very personal decision. And if you find that you're struggling with these factors, you're not alone by any means. It's actually the number one thing that we discuss, and something that I love about my job is I get to walk through these factors with you and decide which ones you want to prioritize, and then narrow down to a specific plan in order to do that. So here are some tools you can use when considering which plan to choose. The first is cost. How much do you want to pay as part of your premium? The second is the doctors that you want to see. Many of you have long-standing relationships with your doctors. If it's important for you to continue to work with a specific plan, and for example, you want to go with an Advantage plan, then you need to make sure that your doctor is in network. And it would be really helpful there to either go to the insurance carrier's website and make sure that your network is going to cover that doctor, or you can work with an advisor and we can tackle that complexity together. And then the third thing to consider are the prescriptions that you take. And finally, where you live, whether you're moving, if you like to travel like Linda does, you need to make sure that you're going to be able to, or that you're going to have coverage when you travel outside of your community, because it's really important that you find a doctor who's going to accept your plan in case something happens when you're away. And I want to stress that these plans change every single year. In fact, we just got plan data for 2021, and we finished inputting it into getchapter.com this morning. And I can confirm that the plans for next year are priced, many of them, in fact, are priced differently. Some of the benefits have changed between plans, and that the doctors you can see within each network have changed too. So if you want to confirm your plan's network, again, you could do that alone by going to the website, or you can work with an advisor. And right now, in fact, starting next Thursday is when you have maximum flexibility in order to reselect your plan or to confirm your coverage and make sure that you're on the best plan for you. If your plan changed, now is the time to check, and we can look into that together. And I want to be clear that we are just one of several advisories that offer this, but it is really important that if you have a complicated situation, or maybe even if you just have questions and you want to get answers to those questions, you don't need to go through this process alone. You can work with an advisor. We're available to you, and there are other advisories too that you shouldn't have to do this by yourself. So here are the top 5 Medicare misconceptions that we see. I want to go through these with you one by one. It will help you avoid mistakes that we commonly see, and no pressure in writing them down. I'm actually going to recap them at the end, but I really want to go through these with you one by one because I hear them a lot and it just makes me great when I do. Misconception number 1, traditional Medicare covers all medical costs. As Assemblyman Kiley said at the outset of the presentation, it's not true. In fact, traditional Medicare leaves you covering at least 20% of your medical costs. And it also doesn't include those supplementary benefits that were really important to Ronald. Misconception 2, Medicare coverage is automatic when you turn 65. You know that's not true. Linda did not have Part B when she turned 65. We advised Linda to wait until she retired in order to opt into her Part B benefits. Traditional Medicare Part B is not something that's automatic. It's something that you must opt into in order to start receiving those medical insurance benefits. And it's also something that you need to begin paying the premium on too. Misconception number 3, it doesn't matter when you sign up for Medicare. Ooh, well, the reason it really matters when you sign up for Medicare is because there are penalties for late enrollment. In fact, you'll pay a 10% premium on top of your Part B you'll pay a 10% penalty on top of your Part B premium for every full year you wait to sign up. There's also a Part D penalty. It's 1% of the average for every month you wait after the end of your initial enrollment window. And to show you just how punitive these penalties are, I want to show you that if you actually wait over 4 years to sign up for your Part B after you become eligible, you're going to owe a 40% Part B penalty premium, and you're going to owe 40% penalty on top of your Part B premium. And further, you're going to owe a 53% penalty on top of your Part D premium just by virtue of having been late. So it's really important when you enroll. These are lifetime penalties, and they get bigger the longer that you wait. Misconception number 4. Your neighbor's Medicare coverage is a good plan for you. Oof. Well, let's go back through the factors. And well, you should ask your neighbor if they may use these factors in considering a plan. And if they use these factors, well, maybe it's an okay plan to consider, but here are the factors. The first factor to consider is the cost of the plan. What's your risk tolerance? Do you prefer paying a lower premium up front, but having a little more out of pocket if your medical bills become really high? Or do you prefer the inverse of that? The second thing that you and your neighbor might differ on is what doctors and networks you like. Do you see the same doctors as your neighbor? If you don't see the same doctors and you choose an Advantage plan, then the doctors you want to see may not be covered in the plan that you chose because your neighbor's plan has a totally different network of doctors. The third thing are prescriptions. If you're not on the same prescriptions as your neighbor, then you probably want to make sure that any prescriptions you take would also be covered by your neighbor's plan. And then finally, your location and lifestyle preferences. Look, whether you prefer to stay around Granite Bay or you love to travel, that will really affect the type of plan that you choose, be it Medigap or Advantage, and also the specific plan that you choose within that subcategory. So you really want to make sure that you get clear about what your preferences are and how they might differ from your neighbor when thinking about using your neighbor's plan as just choosing that. You need to be really intentional about it. And just by attending today's presentation, you clearly are. The final misconception: you only need to choose your additional Medicare coverage once. You know that these plans change every single year. We learned that today there are big changes coming, and I want to go over that you should choose or reconfirm your coverage every single year, because what's different between plans is that the premiums may have changed, the benefits may have changed, and the physician networks may have changed. So even if you love your plan now, well, your plan was just offered its benefits for 2020. How are those benefits going to be for 2021? In many cases, we found that the benefits are actually going to be better. But is the plan that you used last year the best plan for you now? Really, the only way to know that is to check your plan and to reconfirm your coverage. And the time to do that is really starting now, because beginning next Thursday, you're going to have maximum flexibility to change your plan. And again, we're here to help you if you're looking at changing your plan, or you just want to know how your plan may have changed between 2020 and next year. We can walk you through those options. Me or a team member would be happy to. So these were the 5 Medicare misconceptions we see. Let me recap them with you. The first is traditional Medicare covers all your costs. You know that's not true. There's a gap. Second, it's not automatic when you turn 65. It's something that you have to opt into for Part B, and it's really important that you do. Otherwise, you're not getting the benefits that you need in order to ensure that you'll be safe during your retirement. Third, it really matters when you sign up. There are big penalties, lifetime penalties, if you don't. Fourth, again, your neighbor has different factors that they chose their plan on, and you may have, your preferences may differ from your neighbors, and they probably do. I'm really guessing that they do. So that's something for you that only you can know for certain, but you definitely have some questions to ask your neighbor if they recommend the very same plan that they have. And then finally, you need to choose your Medicare coverage every single year. It's not something that you can just set and forget, like buying a life insurance, It's something that you need to be really intentional about because the benefits, network, and even the premiums are changing every single year. And we've definitely found that to be true as we look forward to 2021. All right, so I've reached the end of our journey. There are a few takeaways I want to leave you with. The first is this is really a complex process, and so it can help to work with an advisor. Here are some things you might want to consider when choosing an advisor. These are just questions you might want to ask. The first is make sure that the advisor you work with, make sure they're independent. The reason I say that is because we find some advisors, not all, but some, only work for one or two insurance carriers. And that's really going to limit the options that you have and the flexibility. Because if they're only working with one or two carriers, then they're really not able to offer you as many as all the things, all the benefits you might be able to get by having a full suite of insurers to compare against. The second thing is that make sure that the advisor you work with offers both types of plans. Remember that stage 2, they offer both types, Medigap and Medicare Advantage. Because if your advisor is only a specialist in one type of plan, that's really going to affect the types of plans that they recommend. If your advisor only sells Medigap, for example, then I would bet that sadly, they're probably going to offer you a Medigap plan because they just can't recommend, they just don't know as much about an Advantage plan. It's not as something that they have as much experience advising on. And then finally, make sure that the advisor you work with offers all plans. There are some compliance and regulatory hurdles here. It's not easy to be able to sell all plans. So it shows that your advisor has been really intentional and really thoughtful about what plans they want to offer if they're able to offer you a full suite of plans across Medigap and Advantage. So these are really some questions to think about if you're considering working with an advisor. And of course, Chapter checks all of these boxes. There are other advisors that check all of them too, though. So I want you to stay in touch with me. It's been great being with you the past half hour. I'm really looking forward to your questions in the Q&A. My email is ari@getchapter.com. It's right on the screen. My number is listed as well. And please reach out to me. I really want to hear from you after today or even tonight. And with that, I'm open to questions.
Yeah, thank you very much, Ari. And I see that we've already got a number of questions submitted through the YouTube Live. So we'll just start addressing those. And if you have others that occur to you, just feel free to add them to the list.
All right, I am going to read the question to you. So this is coming from Andy. She says that he or she says that they live near Sacramento and go to Arizona for 3 to 6 months every year. Is there an easy way to find supplemental plans that offer coverage in both areas? So Andy wants coverage in both Arizona and also in your community. So the answer, Andy, is that yes. With a Medigap plan, you can see any doctor who accepts traditional Medicare, regardless of your location. So the factor that was important to you, Andy, was also something that was really important to Linda. And so I think you'll find that Medigap is likely the best option for you. And I want to be clear that even if you're over the age of 65, so you're not using your initial enrollment period, you still might have a special guaranteed issue period. So you might be able to get a Medigap plan without needing to undergo health underwriting. And I would encourage you to reach out to us after the presentation so we can find out if there's a guaranteed issue window that you might be eligible for. All right. That was a great question. Next question is from Peter. Where do I sign up? So you can sign, I think you're referring there to Part B. I think you're trying, Peter's might be trying to sign up for Part B under traditional Medicare. And the answer is that you can sign up via the Social Security Administration, ssa.gov. That has a website up as part of COVID, actually. So it's great that you can go to ssa.gov and be able to opt in to Part B. You should remember, though, that that would only allow you, Peter, to enroll in traditional Medicare Parts A and B. You also may want to consider additional coverage because there'll still be the question of what you want to do with the 20% of medical costs that Medicare doesn't cover. Next question is from Stuart. Why is Linda still contributing to an HSA? So an HSA is a health savings account. So is Linda still contributing to an HSA? Well, Stuart, Linda can keep her HSA, but she cannot continue contributing to it once she is on Medicare. She can use her HSA funds to pay for her Part B premiums, though. And that's actually a really nice feature of an HSA, and it's something we advise our clients on, and it's something we really recommend. So thank you, Stuart, Peter, and Andy. Those were great questions. I'm just waiting for a few more. Okay, a question from Mike. Must you sign up for Part A if you are still employed? Ooh, well, Mike, technically you can opt out, but we don't recommend that since there's no cost to you for Part A as long as you've been paying for Medicare payroll taxes for at least 10 years. That's something actually you noticed that for both Ronald and Linda, we advise them to sign up for Part A right off the bat because they'd already paid into it. Okay, and then a question from Name Unknown, which is totally great. So this is from Anonymous. Isn't it Medicare A and B and Medigap versus A and Advantage? So I think the question from Anonymous is on whether to consider Medigap versus a Medicare Advantage plan. And the answer is that it's not quite. To have Medigap, you really need to have both Parts A and B. So I think what maybe I wasn't clear enough about is that Medigap sits on top of traditional Medicare. So you already need to have Part A and Part B in order to purchase a Medigap plan. And most Medicare Advantage plans, so we're shifting gears now to Medicare Advantage, most Medicare Advantage plans require that you also have Parts A and B. And the government, as I mentioned, will pay some of the Medicare Advantage plan, and they typically offer a lot of benefits. In fact, some Medicare Advantage plans, for example, the one that Ronald purchased, have premiums that are as low as $0. So great question. And I hope I've answered it. If I didn't answer the question as thoroughly as you would have liked, though, definitely reach out to me by email or call, and we can discuss it further. From David. David says that I'm a retired state employee with fully vested medical benefits. Is my CalPERS medical considered a Medigap plan? So let me just repeat this question. David says that he's a retired state employee with fully vested medical benefits. Is CalPERS medical considered a Medigap plan? Well, CalPERS is technically not a Medigap plan. If you reach out directly, we can compare the benefits of your current plan from CalPERS with those of a Medigap plan if you'd like. We've done it with dozens of people just like you, and it's something we'd be happy to do. And again, it's at no charge. So I'm looking forward to hearing from you, David, after the presentation. From Michael. Michael, we don't have dental insurance, or excuse me, Michael says, we don't have dental insurance. I got my spouse dental coverage through Kaiser, but it's very poor coverage. How can I find better dental coverage? So I just want to reiterate that Michael isn't happy with the dental coverage he receives through Kaiser, and he'd like to find better dental coverage. Well, first, Michael, I'd like to say that I'm sorry to hear that. I would like to know further what you don't like about Kaiser's dental coverage so that I can work with you to find dental coverage that might be better. As obviously you're on some type of Advantage plan because of the dental benefit. And so we can find you a plan that has a more robust set of dental benefits if you reach out. Alternatively, you could buy a standalone dental supplement plan if you have a Medigap plan. From Anonymous. If I'm on an Advantage plan, is surgery automatically covered? or does it have to be pre-approved first by Medicare? Well, emergency procedures always need to be covered. Some Medicare Advantage plans may require pre-authorization for certain procedures. If you have questions on pre-authorization, or you want to find a plan that would be better for you for certain conditions or certain operations, definitely reach out to us. There are certain Medicare Advantage plans that are focused on certain conditions. And I think that if I knew more about your situation, I could offer more specific advice here. From Paul. Hi, Paul. What is the window to sign up for Medigap, a Part D standalone plan, or an Advantage plan, especially if you know your 2021 retirement date? Well, Paul, it's great that you know your retirement date already and that you're on the ball, definitely, that it's coming up next year and you're still attending this presentation. So a big shout out to Paul. If you're turning 65, I want to reiterate that there's a 7-month initial enrollment period. If you're leaving your full-time work and you're ready to opt into your Part B, then you need to do so, within 8 months of leaving your job, but you should really do it immediately. And clearly that's something you intend to do so that you don't have a gap in coverage. And Paul, if you want to sign up for a Medicare Advantage plan, you actually have to act earlier than 8 months. You're only going to have 63 days to sign up for your Part D prescription drug plan after you leave your job. After that, you're going to start to pay a Part D penalty. So you definitely want to make sure that there's no gap in your coverage. From Randy, is there a fee to work with an advisor? Randy, there isn't. We search all coverage options for you. We have built the chapter team has built a powerful technology platform to help us search all plan options and all types of plans. And it's free to work with me or my team. We'll never charge you a dime. From Stuart, is it better to work with a local broker who knows the area or a big national firm? Good question. Honestly, you should work with a broker that has a breadth of products they advise on, and also make sure that you work with a broker that has independence, that offers both Medigap and Medicare Advantage, and that offers all types of plans. So you can take Chapter, for example. We search among all the plans in your area, and we've also cataloged every plan's benefits and networks to help advise you on, even for 2021, which we were just doing this morning. So we are ready to go for 2021. From Anonymous, when should you contact someone to review your options? Well, you should reach out to us 6 months before you turn 65 or before you plan to retire, like Paul did. Another question, this is coming through email, which is great. I'm so glad that you are already able to use email. Again, how are we, I think that's referring to Chapter, how are we compensated for our services? Well, like many advisors, insurance companies pay us. Unlike other advisors, though, we recommend the right options for your needs above all else. Even for carriers that don't pay us, it doesn't matter. If the right plan for you is with a carrier that won't pay us, we're still going to make sure that we help enroll you in that plan. Also, you will get the same price on a policy if you go directly to a carrier as if you work with an advisor. I know that sounds weird to think about. Why wouldn't the insurance carrier give you a discount for going direct? But in fact, by law, insurance companies cannot charge you a different price if you choose to work with an advisor or if you choose to go direct. So you should really work with an advisor who's independent, who offers all plan types, and who can search among all insurance carriers if you choose to work with an advisor. And I just want to reiterate that we're not paid by you. From Eva, what about international travel? Sometimes my parents go to the Philippines for a month or two at a time. Many Medigap plans cover emergency travel required abroad. Eva asks, what about international travel? Sometimes my parents go to the Philippines for a month or two at a time. Okay, well, it's great that you're on top of this, Eva, and it's so wonderful that you attended today's talk in order to help your parents navigate through the Medicare process. I think that's really tremendous. And well, Medigap plans cover emergency travel required abroad. I want to note here that it's not all Medigap plans, it's some of them. And by telling me more about the type of, like additionally, what factors your parents are looking at, then I can advise you specifically on what plan you may want to consider. From Randy, I have Kaiser and it's a convenience. Oh, you like Kaiser. I have Kaiser and you like its convenience. Okay. So Randy has Kaiser and he likes Kaiser's convenience. That's really good to know. But Randy asks, what happens if I need a doctor when I'm over 100 miles away from Kaiser? So I'm assuming that Randy has an Advantage plan. So I think, Randy, the best way to handle this question would be to work with you to check and see if your preferred doctor is in the Kaiser network. It's great that you like Kaiser's convenience, but there might be other plans that have the doctors you like working with. And we can do a factor by factor comparison if you're thinking about whether Kaiser is the right plan for you when you travel 100 miles outside of the network. From Anonymous, if you have a retiree health plan that starts when you turn 65, plus you receive Medicare cards in the mail because you started taking Social Security before turning 65, how does that work? Okay, so the question from Anonymous is that they have a retiree health plan that started when they turned 65. They also receive Medicare cards in the mail because they started taking Social Security before turning 65. So I think what Anonymous is referring to is Part A. And there are no premiums as long as you paid for your Part A because it's been deducted as a Medicare payroll tax if you've worked for 10 years or more. So you're already paid into it. And there's no reason not to start receiving your Part A benefits. I can see that I'm getting some more questions by email. Let me just open my email so I can address them. Okay, question from Ron. I am currently covered by my wife's group plan. When I sign up for Parts A and B, what plan will be primary? Good question. It really depends on the size of your wife's employer. For employers that are larger than 20 employees, the employer's policy is actually the primary insurance. But for smaller employees with fewer than 20 employees, Medicare is going to provide your primary coverage. You'll note in this presentation, Linda worked for an employer that was larger than 20 employees, and so therefore her coverage was primary, but it's really a great question. Thank you, Ron. From Anonymous, what if you retire at 63, go on federal COBRA until 65 years old to have medical, then at 65, get off COBRA and go on Medicare? So this is someone who used COBRA to make it to age 65 and then wants to go on Medicare and purchase a Medicare Advantage plan. Well, that works. You'll become eligible for Medicare when you turn 65, and then you can use your 7-month initial enrollment period to sign up for Parts A and B, and also choose a Medicare Advantage plan at that point. And if you'd like help choosing or finding the Advantage plan that's right for you, feel free to reach out as you approach retirement. All right, these are really good questions, and I'm trying to get to all of them. But I want you to know that we only have 5 minutes left. So keep the questions coming. I'll try to get through as many of them as I can. And ones that I can't, I'm going to try to connect with you afterwards. So please use my contact information on the screen to reach out to me if you'd like to address your situation one-on-one. All right, from Carol. I have an Advantage plan. Will I be covered if I travel? It depends. It really depends on the service area of the plan that you choose, Carol. If you're traveling far away to another state, I think someone else earlier referenced that, most Advantage plans will not cover care unless it's an emergency. And Medigap plans can be really helpful here because remember, Carol, you can see any doctor who accepts traditional Medicare, no matter what their location is. And if you'd like to reach out and talk about specific doctors that you'd like to see, or if you're wondering about how far an Advantage network might extend, we can discuss your particular situation one-on-one. All right, going back to my email to try to find more questions. Still checking my email. Just 1 second. All right. This question is on guaranteed issue windows. So a guaranteed issue window is really important because it's a way that you can avoid insurance carriers asking you about your previous health history. And remember, under your guaranteed issue window, an insurance carrier has to offer you a plan. They cannot deny you coverage based on any pre-existing conditions that you're coming in with, and there are no exclusions to this. And finally, well, really, I think best of all, they can't price it any differently due to your pre-existing conditions. They have to offer you a plan under your guaranteed issue window, and that plan can't be priced any differently if you're operating under that guaranteed issue window. So that's why it's just so crucial. From David, if you sign up 3 months prior to 65, can Medicare start immediately? Well, David, if you sign up before you turn 65, your coverage will start the first day of the month that you turn 65. So let's take Ronald as an example because his birthday was last week. Ronald signed up early for Medicare, for his traditional Medicare. And so his Medicare coverage actually started October 1st because that's the month that his birthday took place in. From Anonymous, I am covered by TRICARE. Thank you for your service. Is it classified? And just to be clear, TRICARE means that there's prior military service. So Anonymous is covered by TRICARE and wants to know if it's classified as Medigap or an Advantage plan. Anonymous says that they've had trouble finding a doctor who accepts TRICARE. That's such a shame that you've had trouble with your network coverage through TRICARE. I want to emphasize how much the chapter team and I appreciate your service. I'll add here that TRICARE is neither Medigap or Medicare Advantage, sadly. Veterans can sign up for Medicare as well, and you'll want to see how your benefits compare and if a Medicare option can be both inexpensive and help you see the doctors that you'd like to see that TRICARE won't help you see. So if you'd like to learn more about this, feel free to reach out and we can help you evaluate your options and how they compare to TRICARE. All right, these were great questions. There were some really, I wish I could get to all of them, but I'm looking forward to connecting with you by email through our website at getchapter.com and by phone. And I really hope that I hear from you after today. And thank you for learning more about the Medicare process. I hope you have some tough questions. I can see that you already have tough questions. And that's really the key as you go through the enrollment process. You just want to have all the knowledge you possibly can so that you can find the plan that's right for you. And finally, I just want to thank Assemblymember Kiley and his team for hosting. And I want to give it back to Assemblymember Kiley to wrap it up.
Well, thank you, Ari. That was fantastic, and I hope it was help. I'm sure it was to the folks who are watching. My office doesn't usually deal directly with Medicare issues, but for anyone who has any follow-up questions, in addition to reaching out to Ari directly, we can do what we can to direct you to the appropriate resources. And more generally, our office is here to help you with any issues you have with the state, whether it's with the EDD or the DMV or any of the other wonderful acronyms for our state agencies. We're here to help. My office is in Granite Bay. We're open now, but you can always reach us by phone or email as well. So thank you, everyone, for joining us.